Okay. Good evening, everybody. It's from the EIZOC Secretariat. We are here again together for being a part of the webinar, EIZOC Ophthalmic Research and Publication Initiative, ORPI. ORPI will be giving us a guideline for the young generation to come up with a research and publication initiative, which in turn will improve the academic activities and as a whole. With this type of programs, the bond between the states of EIZOC will be tightened. Through EIZOC, Eastern India is gaining its position and repute in the National Ophthalmic Forum. Our Chairman Scientific Committee, Dr. Sabyasachi Patnaik, has framed the webinar in a meticulous way, supported by the coordinator, Dr. B.N. Subudhi sir, and co-coordinator, Dr. Santosh Mahapatra. We had an advisor, none other than past president of AIOS, Dr. Ajit Babu Majhi. The 2-hour-long session will be moderated by our editor, EIZOC, Indian Journal of Ophthalmology stalwart, Dr. Santosh Onavur sir, supported by the co-moderator, Dr. Soham Bosak and Dr. Praveen Subudhi, our young dynamites. We had a galaxy of speakers who are the masters and authority in the field of scientific publishing, led by Dr. Jyotirmoy Biswas sir, with the add-on Dr. Aniruddha, Dr. Jayanta Kumar Das, Dr. Santosh, Dr. Chaitra Jadev, Dr. Manav, and our CSC, Dr. Sabyasachi. We plan to do this type of webinars regularly. In addition, our chairman ARC, Dr. Y.C. Metti, is also planning to have few ARC activities during the year. To all of you to share, our midterm conference will be held on 27th and 28th August at Port Blair. And those of us yet not registered, I request please do it immediately and be a part of the great event. Thank you, and over to our Chairman Scientific Committee, Dr. Sabyasachi.
Thanks, Dr. Suraj.
Before that, I'd like to share the EIZOC video, introduction video. Can I do it?
Yes, you can.
Please. You see it?
No, you share it.
Yeah, one second. Yes, now? Can you see now?
Yeah, but audio is not there yet. Okay.
EIZOC. Now over to Dr. Sabyasachi, our Chairman Scientific Committee.
Thank you, Dr. Swaraj. Now I welcome all of you for this program. We have decided to start a series of program on research and publication.
I think we lost him.
Can you hear me?
Yeah, we can hear you, sir. We can hear you.
Okay.
Yes, Sabyasachi. Yes, you can continue.
So I thank Dr. Santosh Sonavar for accepting our request to have this program with IJO, and we are very happy and fortunate. We can learn a lot of things because we have good number of speakers who have lot of experience in research and publication activities. I have with me Professor BNR Subudhi as the Chief Coordinator of all the academic programs to be conducted under IJO banner. So now over to Professor Subudhi to start the proceeding. Thank you.
Thank you. Am I visible?
Yes, yes.
So as Dr. Patnaik already detailed, I don't want to say much about this program because this is actually we had in the past. This program, we had 26 episodes, but it was limited to the Odisha state. Now we got a broader platform, of EIZOC platform for this research and publication initiative. Mostly we would like to concentrate on the postgraduate students of all the various medical colleges of Eastern Zone. After listening to various programs, at least they should come forward to write a paper and publish in the journals. That is our aim. I'm really very thankful to Dr. Santosh Sonavar in the last meeting at AIO's Mumbai conference, and he has agreed to come to initiate the first session, and subsequently we'll be holding a series of sessions holding with one speaker at a time. These are our team, and I don't want to go into all the details of the team. Of course, we'll be very happy to have Dr. Ajit Babu Maji guiding all the while in our academic programs of EIZOC. We will be joining a little late. And today there is a galaxy of speakers. I will be speaking about the speakers at the end of the and before each talk. Dr. Ajit Babu Maji, Dr. Jyotirmoy Biswas, Dr. Santosh Sonavar, Dr. Aniruddha Maiti, Dr. Jayant Kumar Das, Dr. Chaitra Jaydev, Dr. Manvi Sindal, Dr. Rasmi Desmukh, Dr. Sabyasachi Patnaik, and of course we have got a very dynamic co-moderators, Dr. Som Basak, everybody knows him, and Dr. Praveen Subudhi. These are the two young dynamic people, are ophthalmologists up to Eastern Zone. Dr. Som Basak is currently working as a cornea consultant at Tisai Hospitals in Jimbar, the Prova Eye Bank, and has 15 publications in various peer-reviewed journals and in the reviewer of IJ and cornea. Dr. Praveen Subudhi is the director of Ruby Eye Hospital, Barampur, and he is the editor, Start Pulse, and reviewer of Odisha Journal of Ophthalmology, and he is also reviewer of Journal of Clinical Ophthalmology and Cornea. He has 22 peer-reviewed publications to his credit. So these two youngsters will lead us in our ophthalmology in East Zone. So now I hand over the mic to Dr. Santosh Sonavar, who is the moderator for this session. And I think if Dr. Ajit Babu is joined, he can speak few words. Otherwise, we'll straight away we'll move to the program.
No, he is not joined. He is not joined.
Okay, no problem. So it is over to Dr. Santosh Sonavar. Sir, yours to start the program. And once again, I welcome all the viewers. It's a pan-India program, not the Eastern Zones. We have invited so many people from all over the country. So welcome Dr. Aarti Hadda and so many people that have joined here and also in the viewers. So thank you very much for joining with us. It's over to Dr. Santosh.
Thank you, Dr. Subudhi. I think it's a wonderful initiative by EIZOC to sensitize members of EIZOC societies and All India Ophthalmological Society about the importance of publications and how to go about it. So this is just an introductory webinar featuring the entire spectrum of talks on the ways and means to publish articles in journals and also to do research. Our moderators are Soham Basak and Praveen Subudhi. You want to say something at this stage, Soham and Praveen?
No, sir, please carry on.
All right. So then I would invite Dr. Jyotirmay Biswas for his first talk. Dr. Biswas, of course, is a well-known academician. He doesn't really need any introduction. He's the face of UVI in India currently and heads that service in Shankanetralaya. He's a very experienced academician. He has published a lot, so to say, and helps EIZO in many ways as a reviewer, and he continues to be an author and locks in a lot of citations, thus boosting the impact factor of EIZO. Thank you, Dr. Biswas, for being here.
Thank
you. Want
you.
to share your screen and start your talk. He wants to, Dr. Biswas is speaking to us on his experience in writing original articles.
Thank you, Dr. Shubhodhi, EIZOC, and Dr. Santosh for giving me this opportunity. Let me see that whether I can share the screen. Click. Is the screen visible?
Yes, sir. You can go to show.
Show, slideshow, I'll go.
Yeah.
So I once again like to thank Dr. Shubhodhi, Dr. Santosh, and EIZOC for giving me this opportunity. I'd like to share my experience and tell about the importance of publication in the scientific journals and the lessons learned over the years. I'd like to start with a quotation from Huxley, which says the known is finite, the unknown is infinite. Intellectually, we stand on an islet in the midst of ocean of inexplicability. Our business in every generation is to reclaim a little more land. With the publications and numbers, it doesn't matter. Actually, what we are trying to do is to reclaim a little more land. It says that he did not publish, so he perished. Actually, we can publish and flourish. Publication is not an easy. It goes to the peer review process, editorial board, and editor's decisions. So, but it's important that you do publish. It is the progress of the science, advancement of academic career, indicator of performance in science. A scientific work, no matter how spectacular the findings are, is not complete until it is published. The scientist must not only do research, but also must write up the research works to communicate with others. So what is required is enthusiasm, persistence, strong commitment, and passion. What is in it for you? It's aged in history, persists forever. You can be proud of it, in fact. Publication is the gold standard. You can learn from the review process, learning from the literature review which you do for publication. Knowledge gets crystallized in the process. I have got 5 commandments before I start writing or thinking of writing. Assess whether the work is fit for publication, had enough data, good documentation, conclusions. What are the potential audience for these communications, like all ophthalmologists, ophthalmic subspecialties, specialists, or medical specialists? And what is the most suitable and prestigious journal to attempt for? You should keep in mind, always look for peer-reviewed and PubMed index journal. How to prioritize your work so that you can put that work with a priority and can go ahead. And what is the time frame for your paper writing work? A paper is not complete until it's dispatched and published and printed. So I started with a very small case series of sporadic cases of acute hemorrhagic conjunctivitis of enterovirus type 70 from PJ Chandigarh. What I did, I collected all conjunctivitis cases, acute, took them to the microbiology department personally. It was a labor learning curve, putting in the data together, and that resulted in the paper. And fortunately, I was the last author of the paper, which is nowadays is most important. My publication in fellowship in 1989, during my fellowship in USA, Doheny Institute, University of Southern California, 2 patients I had eyeball who had peculiar choroidal lesions Both the patients died. I collected the eyes and found that they have got peculiar choroidal infiltrate, which has got a frothy eosinophilic material, and which GMS stain showed a new organisms called Pneumocystis carinii, which we published. What we did is that we took each of us one part of the work, and 7-man team wrote that publication, which was the first of its kind of Pneumocystis carinii infection in the eye. This is a case which I've encountered with Dr. Badrinath, is that one patient presented with the peculiar features of woolly strands like vitreous opacity. And it was found out by doing the histopathologic study. This was an amyloidosis of the vitreous. It was a rare case. And I wrote 7 pages. And reviewer asked me to reduce it to 1 page. I didn't know how to do it. I gave it to my wife, who is a physician, who cut it up, and wife is the best critic, and he did it to 1 page, and it got published. So never say die attitude, take all the avenues to get your paper published. So I reported in the 1993 frozen section diagnosis and ophthalmic pathology. It's a very simple case series. I just collected the data, and the simple ideas can also work well in the publication. This is a paper of pathologic studies of Nathostoma spinigerum. I compiled the clinical data, obtained microphotograph, took it to the botany department for electron microscopy, and seeing a parasite in the eye is a chance, but working it up fully and writing it up needs effort. And if you put an effort, it never fails. And this was the clinical photographs of the various features of this Nathostoma spinigerum. And we did the first time that the scanning electron microscopy of the parasite with the histopathologic study. We had a chance to see a patient who died of malaria, falciparum malaria. I got the eyeball, donor eyeball, which came in the histopathology department for corneal transplantation. When I found that the hemorrhage in the eye, I got into the details, made multiple sections, and I could find out the malaria parasite in the choroidal blood vessel, which resulted in a publication. I also did that pattern of uveitis and referral uveitis clinic with my fellow, and this was done on the 465 new uveitic cases. I don't want to go to the finding, but the process of writing is in a record which I used to keep by my own hand, writing the details of this one, and then got it as a free paper in the EIZOC and then wrote it up. So keep track of your patients, and you can write a case series. And what I did, I followed it of 22 years. And after that one, I wrote an article in Indian Journal of Ophthalmology, changing uveitis patterns in South India, comparison between the 2 decades. So keep following your data, and the process you can learn and share. I did the work of ocular morbidity in patients with active systemic tuberculosis with Dr. Badrinath. It's a labor learning curve with 1,005 patients studied in over 1 year period, analyzed it, wrote it up, and published. And those days, the statistical work which we do ourselves only, there is no software available. And this is the tuberculosis center where we went there. And this is another area I worked in, the ocular lesion in AIDS in India. I saw 2 cases of AIDS in 1995. And in a week time, I wrote it up, and this was became the first to report the ocular lesions in AIDS. The speed does matter in publication, and I followed it up. And then when you got together 100 consecutive patients, we published in American Journal of Ophthalmology and showed that 40% of the Indian patients had 1 or more ocular lesions. So this paper was not easy. A 4-page review came with a criticism, replied satisfactorily all the queries. So if you believe in yourself, in your data, you can really publish it and go with that one. Ocular tuberculosis in acquired syndrome. This was the first report from the India, as well as the few reports from the world in AIDS patients having ocular lesions. We documented all the various lesions in the eye due to the tuberculosis and published in American Journal of Ophthalmology. 4.8% cases of AIDS had ocular tuberculosis. So we did not stop at that one. We followed it up, and when we had 1,000 cases, we wrote a study of that one heart era, ocular lesions in AIDS with Sudarshan, Dr. Sudarshan. And then another area we worked on the EELS disease, which was the most common retinal vasculitis in the Indian subcontinent. And some time ago, some years ago, made 18 publications of this enigmatic disease. So when you compiled this data of our articles and also 300 full text articles and wrote a review article, which has now become a landmark article in EELS disease. So we did the polymerase chain reaction for the specimens from the epiretinal membrane in the EELS disease, and found that the Mycobacterium tuberculosis DNA is found in the EELS disease specimen. And here we worked with the microbiology department, and we found that the collaboration was success to this paper. So we postulated the cell-mediated immunologic reaction triggered by sequestered Mycobacterium tuberculosis antigen is responsible for EELS disease. So we, not only that, we compiled our 15 years data of 500 patients, 898 eyes, and it was a huge data. And we found that EELS disease can be bilateral, recurrent, and we update our knowledge with a review article on update of EELS disease. We described first time a kind of a disease called amphigenous choroiditis, which is a distinctive clinical features, and so which was away from the norm. And we subsequently we did a larger series of VKH cases from the India. We used to see a lot of VKH cases. We compiled the data and found that the extraocular signs are far less common than other populations. So new therapy we tried with the mycophenolate mofetil. When you got 7 cases, we put together and published this article in International Ophthalmology. So Ojudex implant, when it came, we tried in the intermediate uveitis and published it in Indian Journal of Ophthalmology. So it's don't lose the opportunity, be the first to report it, and at least from India. And this was the Ojudex implant in the vitreous cavity in intermediate uveitis. Last is the tubercular scleritis in a patient with rheumatoid arthritis. The story is that we initially thought that it is an immunologic disease. So, but the patient turned out to be not responding to the treatment, become painful, blind eye. And when we did the pathologic study, we found that the patient had tuberculosis. In fact, the patient died unfortunately due to the tuberculosis. But we collected the data, reviewed the case, and analyzed it, and tried to perfect the cause and effect relationship. This was a histopathologic study of giant cells and PCR study for Mycobacterium tuberculosis. My latest publications is the retinochoroidal invasions of our group in macular regions in eyes with tubercular serpiginous like choroiditis using swept source optical coherence tomographic angiography, which is a new tool in imaging. And I put this thoughts about my writing and publications in Indian Journal of Ophthalmology way back in 1998. With Shobhashachi, we wrote and published or perished The Art of Scientific Writing. So in summary, what I wanted to share with you is required in publications enthusiasm, persistent, strong commitment, and passion. It is a level learning curve. It's not an easy one. Teamwork, work on it, deliver it, and do the things together. Never shed die attitude. Simple ideas can work well. Rare cases must be reported, should be reported in the literature. Speed does matter. Keep track of your patient case series. Believe in yourself if your data is all right. Hard work pays, always remember. Keep an eye out for the deviation from the norm. Collect cases that you encountered a lot. Report patterns and manifestation. Explore the novel treatment and share your experience. Never take a disease entity for granted. Always try to establish cause and effect relationship. I like to end with the same quotation that we try to, every generation, our duty is to reclaim a little more land, and that will add to the knowledge. Thank you very much. Thank you for the opportunity.
Thank you very much. It was a wonderful talk, summarizing all your experience over 497 publications, which most of us can't ever reach. So does any of the panelists have any questions for Dr. Biswas? Or do we do the discussion at the end?
Also, we can have discussions, short discussions right now. It will be better.
One, two questions.
Go ahead, Praveen, you can ask questions.
So what is the, so for my question to sir, it was a wonderful presentation covering all the aspects of publication. And as you already mentioned that in a publication, the most important thing is a perseverance. So whenever you have an idea, when you write, it will take a long course to get published. In the due course of time, you may have encountered rejections. And my question to you, sir, how did you face your initial rejections and how did you overcome it?
So I look back to the reviewer comments very seriously and where I went wrong, and I always try to modify it and take the points from the reviewer and don't submit the same article again until I'm quite satisfied with it. It goes to the various, send to other peers to have a comment where you went wrong, and then try for another journal. Sometimes it happens in the rejected in the lower journal, lower impact factor journal, but got it admitted, got published in better journal also. So, but you need to always look into it carefully again. And I don't lose heart if my data is correct.
Yes, and another thing, how do you feel let down when the paper gets rejected? When you feel that your paper is too good for the acceptance, and but the peer reviewers don't feel that way. So do you feel let down in that cases, and do you get demotivated in those cases?
No, actually, is a part of the game. I learned by the process by the reviewers. I always try to take the positive thing about the positive points from there. But if outright it gets rejected without proper review process, then I get little frustrated. Otherwise, not.
Thank you, sir. Any other questions from other panelists and the?
I think we should move on to next speaker because time is, yeah.
So the next speaker is none other than Dr. Santosh J. Honavar, and I don't think he needs any introduction. He's one of the stalwart and pioneers in publication in the, he's the editor, currently the editor of India Journal of Ophthalmology and EIZOC case reports. He's the director, Department of Ocular Oncology and Oculoplasty at Center for Sight, Hyderabad, and director, National Retinoblastoma Foundation, and the CSIR India, the apex agency of the Government of India for Scientific Research, awarded him the Shanti Swarup Bhatnagar Prize for Science and Technology, and is also now, I saw in the Facebook, is the executive member of International Society of Ocular Oncology. Sir, thank you for sharing your thoughts and for giving us the path to publish more. Over to you, sir.
He should be congratulated immensely for the steep rise of impact factor of EIZOC. Thank you, sir.
Yes, sir.
Yes, it's a fabulous job.
Thank you so much. Thank you all. I would, after a very nice talk by Dr. Biswas as to how and why should you publish, now the next obviously question is how to find a good journal for publication. Dr. Biswas conveyed very emphatically that we publish to be discoverable, accessible, and your material, whatever that you should you have published, to be reusable. It in fact gives academic immortality to the author. I think there is a disturbance from one of the audio, right? All right. So it's a jungle out there. When you talk about journals, there are not hundreds, thousands and tens of thousands of journals out there currently. And sometimes it becomes difficult as to find out which of the journals would suit your article. So what is the criteria for a good journal? A journal of professional repute, a journal which is indexed for sure, journal which is published by a professional society. For example, AIOS is the society that publishes EIZOC, whereas American Academy of Ophthalmology's official journal is Ophthalmology. The journal should also have a compact and a defined review time, should not stretch to several months. It should be regularly published on date every month. There should not be any unpredictability in the publication sequence. It should have a good or a reasonable impact factor. And the decision process has to be timely. It should not take months to years. And after decision is taken, the publication time should be reasonable. Somewhere around 2 to 3 months would be considered reasonable. And if it cannot be immediately published in print, at least it should be made online as soon as possible. And your targeted audience should read the journal. For example, if you're publishing something very relevant to India, there is no point publishing it in the Middle Eastern Journal of Ophthalmology. Although all the journals are currently accessible online to anyone, but it makes sense to publish an article which is relevant to the population or the readers who are interested in it. There are 3 factors. One is scope, repetition, and turnaround time. These are the factors that you must consider. Scope is nothing but fitting your article to the journal. For example, if you have written a photo essay, then not all journals may publish a photo essay or an ophthalmic image or a case report. So you have to find out a journal which publishes it. Similarly, if your article is too basic, most of the clinical journals would shy away from publishing it. So you have to find out a journal which publishes basic and translational research on priority. So the question in scope is, does your article fit the focus area of the manuscript? Does the journal regularly publish the category of manuscripts that you're aiming at, or is it very sparse? For example, if a journal publishes 1 case report a month, then obviously you may not stand a good chance of having it accepted. Does it serve your target audience? So you should know your audience, who you're writing for. Repetition is measured in terms of years of publication, whether the journal has been indexed. Is the publisher a professional publisher who's a known professional publisher? Is it an official publication of a reputed professional society? Does it have a reasonable impact factor? And do your peers know about the journal and regularly access it? So at this point in time, I have to bring in the concept of predatory journals. Predatory journals are the journals which seek manuscripts for publication, publish those manuscripts without much of review. In fact, they publish at a lightning speed of a week or couple of weeks. Publishers are often unknown. Although you all are ophthalmologists, you will not know them, know the editors of the journal personally or even otherwise professionally. They charge a hefty publication fee for manuscript processing. They're not indexed. There is no element of peer review, and they're not listed on directory of open access journals. So you can easily open the directory of open access journals and look for these journals. And if this journal is not present, then it's most likely a predatory journal. There are actually lists which list the predatory journals. They are called Beall's list, and also a website which lists predatory journals that's called predatoryjournals.com. If you go to these websites, you can find predatory journals. Coming to turnaround time, what is accepted is 6 weeks to 3 months is acceptable. Initial technical check should take about a week or 2. Peer review process should take about 6 to 8 weeks. And if it is sent for re-review, it takes about 3 to 4 weeks. Acceptance to proof takes about 4 to 6 weeks. And acceptance to publication takes about 3 to 4 months. And if it's not published immediately, it should go as AOP. So this is a short checklist. Is the manuscript within the scope of the journal? And are you aiming at the target audience? Is the journal popular among your peers? Is the journal optimally visible on digital databases? Is it accessible? And what about the acceptance rate? And more importantly, if you are a little selfish about publications, you should also think of, does the publication add to your CV in any way? And can you afford the hefty publication fee? Sometimes mismatch is style, but it is always important to find the right match as far as publications are concerned, and it is not good to bark up a wrong tree. But why publish in EIZOC? Now, coming to EIZOC itself, it's a reputed national journal. It's the official journal of All India Ophthalmological Society. 25,000 AIOS members access it. It's an open access journal with 500,000 online hits per month, which is about 5 per second. One per 5 seconds. It has a high citation if the manuscript is good. In fact, some of the articles in EIZOC have garnered 200 to 300 citations over 2 to 3 years. Your peer group reads it. It is aimed at Indian ophthalmologists and ophthalmologists from the Asian region. They read it. and residents read it. These were the editors of EIZOC in earlier years. They all are highly reputed. These are some of the cover pages of EIZOC. We have made it attractive so that people pick it up and start reading it. Every month has a new and attractive cover page. And recently we have started featuring Indian and international legends on the cover page. These are some of the recent cover pages. EIZOC has a nice website which is run by Lippincott, and the journal website also features altmetrics. Altmetrics are the alternative matrices which are currently favored. These include social media mentions and also non-formal or informal citations for the manuscripts, irrespective of whether the cited manuscript is published in a printed version or a digital version or even on a social media. All this is gathered as alt matrices. This is a new style of gathering importance of your manuscript. EIZOC also has social media presence. Now, what the report card about EIZOC is that there is a tremendously increased number of submissions from 575 in 2016 to 2,785 in 2021. This is from India. So there's obviously more than 5 times increase in number of submissions from India. That does not mean that international submissions have reduced, but relatively so, yes, Indian submissions have increased. Increased overall submissions from about 1,000 in 2016 to 3,800 in 2020, and that is constantly growing, a growth of about 380%. That has resulted in increased number of publications as well. Now, looking at the citations, there has been about 330% increase in the number of citations from 1,424 in 2016 to about 4,700 in 2021. And that has also resulted in a very robust growth in impact factor, starting from my baseline at the time that I was handed over the journal of 0.835 to the latest 2.969. And looking at the citation trajectory, this should easily hit close to 5 next year. EIZOC is an open access journal, so it is highly accessed. What is most important, which I would like to highlight, is that publications in EIZOC have helped add about 2,000 new unique authors to the pool of Indian researchers in the last 6 years. This is after surveying the authorship, irrespective of the position of the author on the authors list. About 2,000 new authors have been added to the pool of Indian researchers in the last 6 years. And the number of publications have actually hiked up the rank of the country itself in terms of ophthalmology publications country ranking. India was in number 6 position in 2016. Now it has moved beyond Japan, Germany, and UK to go to number 3 position. We can easily bypass China in the next couple of years, I'm sure, but US is a hard target. So we have improved in our country ranking to number 3 position, essentially because people have been now able to publish. New initiatives, of course, has been EIZOC case reports, which has been welcomed very well. And it has published case reports from 24 countries, including some of the outstanding countries in academic hierarchy. EIZOC videos is a new edition. If you're a busy practitioner and you cannot write an article, you don't have time to write an article, simply submit it as a video with commentary, of course. And it is also currently index publication. So I'm grateful for the trust that was bestowed. Thank you so much.
Thank you, sir. Thank you. I think it was an outstanding presentation. I think the EIZOC, the trajectory is revolutionary in the current. I think I have never seen any journal having such heights in the impact, in the growth in the impact factors. I would like to request Soham to have some comments.
Yes, sir. So congratulations to the entire EIZOC editorial team for achieving what EIZOC has become today. It's an amazing feat that has been achieved in the last 5 or 6 years.
Thank you, sir. You've been a part of it. You're a very regular reviewer, and your reviews are excellent.
Thank you, sir. A quick question, sir, for the students who are listening. So when they're looking to choose a journal, apart from IGO is of course very accessible for and very friendly to the new publisher, new author. But if they're looking at any other journals, is there any list or any guidelines that they should follow, or they would just choose any journal at
They can't
going?
choose any journal. They probably have to look for the impact factor. You know, if a publication is meant for, say, an academic position or promotion, then it has to be UGC. It has to be listed in the UGC list of approved journals. That is important. Otherwise, it should be an index journal unless it's a new journal with a promise to indexation. For example, IGO case reports is not yet an index journal because the process of indexation itself takes about 4 to 5 years.
Right.
But it is on its part to indexation, it's a sister journal. Similarly, sister journals of any reputed journal can be considered for publication because all the indexation happens retrospectively. Once the journal gets indexed, all the articles that are published over the years will also get indexed. For case reports, BMJ case reports is a good source, but then it is paid journal. So unless your institution has subscribed annually for a certain number of articles to be submitted to BMJ case reports, they may not accept it. So similarly, depending on the type of article that they've written, they can match a journal which is possible, which has possibly gives them a scope to publish.
Any other questions from other panelists regarding IGO?
Phenomenal, great.
You can proceed. Next talk.
Soham, can you?
Yes. So our next speaker is Dr. Aniruddha Maiki, who is currently the director of Global High Hospital and also the Joint Secretary of the Ophthalmic Society of West Bengal. He's a senior VR consultant and is actually a teacher at heart, training students for more than 10 years and has numerous publications in various national and international journals and has presented in the national and international VR Society conferences. Sir, please go ahead with your presentation.
Thank you,
He'll be
Sean.
talking on literature search and reference management.
Yeah, thank you, Sean.
Before starting, is there any audio glitch? I'm having the audio glitch. I think it's with other people or it's with me only.
We are also facing the same thing. There is an audio disturbance.
Am I audible?
Yes,
Yeah, you're very audible. It's very clear.
Okay.
Continue.
So at the outset, I would like to thank Shubhiti sir for giving me this opportunity. Well, my topic is literature search and reference management. It's very difficult to talk after two stalwart has just spoken before me. Well, I will try to do some justice to this topic. Well, as we all know, how to search literature is an exhaustive procedure. It's an Herculean task, and we will see whether there is a systemic approach to make this job easier. Now, what is a literature? It's a collection of all the scholarly writing on a topic. And coming to the literature search, it's a methodological search for the literature published on a topic. An effective search of the literature can be done quickly, but demands a well-organized and a systemic approach. And it is important to keep records of the searches made and the information found. Now, there are types of literature like research journals, the standard books, online reports, the online journals through PubMed and Google Scholar. Now, there is certain classification of resources. There is some type 1 resources, which is said to cover the background or the factuals. That is example of textbooks, handbooks, manuals, and dictionaries. Type 2 is the resources that cover the latest of past research. That is the journals and the journal database, that is through PubMed and Embase. And type 3 resources, this is analyzes or summarizes or comment on the type 2 resources, that is a systemic review or a meta-analysis. So these are the 3 types of resources. Now, before going into the literature search, there is some preliminary steps. We need to develop a research question. We need to conduct a preliminary search, identify the relevant search term or keywords. This is very important to identify the keywords. This is one of my initial original article. This was about studying the residual retinal sensitivity in retinitis pigmentosa patient. The keywords were multifocal ERG, the principal component analysis, and retinitis pigmentosa. And this is from a recent publication where we wanted to study the effect of a new molecule in Indian patients. So the keywords were the new molecule, brolizumab, inflammation, and age-related macular degeneration. Now, there is, as we were mentioning, that there should be a systemic approach. There are several tools where we can do a proper searching. Something which is called a Boolean searching. When performing a Boolean search, one should first choose the keywords that best describes one topic. Then you must connect these keywords using the operators and, or not. We will come to the examples. Coming to and links words together in a way to narrow our search. It tells the service provider that we require the data that contains all the keywords given by us. Suppose our keyword is smoking and lung cancer. So when we combine that is smoking and lung cancer, the resulting article should contain both smoking and lung cancer in it. So it narrows down our search. On the other hand, if we go with or is broadens or widens your search results, it is smoking or lung cancers. So it actually widens, because any article with smoking we will get, any articles with lung cancer we will get, and obviously with both the terminologies we will get. And coming to the last one, that is not operator, helps us in just eliminating or avoiding some words from our search. Smoking, not cancer, or cancer, not smoking. So we will get articles mentioning smoking, but not cancer. On the other hand, we'll get cancer, but not mentioning smoking. So this is one systemic approach, that is Boolean searching. Let's look at some other search strategies like a truncation or wildcards. The truncation and wildcards are symbols such as asterisks or a question marks, which are used in some computation comments or searches in order to represent any character or range of characters. So let's be a little bit details on the truncation. The truncation symbol, as we see, is asterisk, serves as a substitute for any string of 0 or more characters that is used for words with a multiple ending. Suppose therapy, therapeutics, and therapies, we can combine them with or, as we were mentioning in the Boolean searching, therapy or therapeutics or therapies. Instead, we can use the simple term therapy or diarrhea. That will actually get all the related words, and we can get all the articles. What do you want the literature to search? We need to ask questions. Now, sometimes this is my first time. Where should I start searching? By walking logically through some steps, we could make our search focused, systemic, and effective. One of them is PICO or PICO. It's an acronym used to identify 4 primary components of well-formulated questions. P stands for problem or patient population, I is for intervention or exposure, and C for comparison, O for outcome. Now, which database or search engine should I use? Well, there is many search engines. Most of us, we use the PubMed Medline and the Google Scholar, the Cochrane Reviews libraries. So where to begin a search? The Google gives an unfiltered haystack approach. Google Scholar is a more scholarly approach, and PubMed is definitely the recent and advanced search. And most of us, we use this PubMed. How to use a Google Scholar? Well, we can search for the books and articles. We can go to an advanced search. The title links to the abstract and possible source of the full text, the link to the articles that cited the work, and link to the related articles. So this was about the Google Scholar. Now, how to search in PubMed. Now, PubMed, we go to the PubMed homepage. We go to the MESH database. What is MESH database? MESH is the medical subject heading or MESH. We were mentioning about the keywords. The keywords may not be the MESH words. So what are the MESH? It is a controlled vocabulary list of more than 25,000 subject headings. 10 to 15 mesh are assigned to each article in PubMed. The mesh index of 10 to 15 subjects heading is like a keyword abstract of the article. Now, for an example, let's have an identify a question and a key concept. The example is advanced nursing practice and trains in graduate nursing education. Now write the search program using the mesh. So we use this in the mesh heading, the advanced nursing practice. Now we get this term is there in the mesh, but it also, it gives a term definition. It also gives the other terminology in a hierarchy fashion, where we get the broadest to the narrowest. If we don't get searches from the advanced nursing, advanced practice nursing, which if it gets 0 results, then we need to use a broader term such as nursing, which is a mesh word. Now coming to the next, we need to put this search in a search builder. As we can see, we have given advanced practice nursing with double quotes. Obviously, double quotes is required. It's a phrase, it's a single phrase. Otherwise, the articles will give mentioning only advanced, only practice. So if we get double quotes, we will get the articles what we want. Now coming to the next one, that is a graduate nursing education. When we search in the mesh, it gives some related mesh words like education, nursing, and graduate. Now we need to put, we need to check the box next to the subheadings like trends. And now we need to add to the search builder. We have already added the advanced practice nursing. Now we add this for the other 3 terms like education, nursing, and graduates. And obviously here we use the Boolean logic, that is advanced nursing practice and the other 3 mesh words. Now when we put this, the final search strategy is prepared. Now we search the articles, and we get around 29 PubMed articles related to our search. Now what we can do is put some filters, like you select the language as an English, or you select the publication for the last 5 years. So we narrow down our search and we get the latest publication in English language. And from this results, we get 22 out of 29. Now display settings we can adjust. We can put as abstract. We can publication date so that we get the latest publications. Now once you get the desired article, you can send to the file, or you can email, or you can keep it in the clipboard, or you can click the full text icon and get the full article. So to summarize this literature search, we need to use the mesh words and the keywords which you have identified for your research questions. Integration, incorporation of the Boolean operators, truncation, as we were mentioning, words with the multiple endings, double quotes to quote the multiple word phrases to get the appropriate search, proper use of filters. Filters might be language, might be the latest publication, and tags. And search in the PubMed should be one concept at a time, not all at a time. So to conclude, we can now see that an effective search of the literature can be done quickly, but demands an organized and a systemic approach. Now coming to the next part, that's reference management. I will be quick on it. These tools, that reference management tools, actually helps to create and manage their list of references, bibliographies for their research works. Most of the tools are designed to organize citation in the specific formats for preparation of manuscripts and bibliographies. And many research tools provide a way to download references into reference management tools. Now, there are many software options. A few are free and few are chargeable with subscriptions, like an EndNote, and free as Zotero and Mendeley. So just to give an example, if you take EndNote, the process goes like this. We need to install the EndNote software, create the EndNote library and add references to it, organize the references, and from this references, we can insert the EndNote references automatically as citation into your Microsoft Word in a preferred style, whether it is a Harvard style or a Vancouver style, preferred style. So at the advantage of the reference management tools that collect references, create references, it helps in collaboration, it can be accessed from anywhere, plenty of storage capacity, and it is safe and secure. So in a nutshell, we need to be a smart searcher and use the technology to build up your reference or bibliographies. Thank you.
Wonderful.
Thank you, sir. Thank you. It was a wonderful presentation. It is a very important topic about literature search. So I usually prefer to go for an advanced search in the PubMed. That is very helpful for me because it gives that, as you said, the Boolean search. It is very easy and or in the format, so we can filter our searches. In normal search, we get a lot of publications, but in an advanced search, you can have a focused search, and whatever the things you want to know, you can have a better, lesser list of publications you can have in that. So do you follow Google Scholar, sir?
Mostly it's PubMed.
PubMed. So the easier the PubMed, because the citations, to get the citations is easy. In Google Scholar, you don't get that type of like that proper format of citations, but in PubMed you get that proper format of citations, which is accepted by the lot of publications. Any other questions from other panelists? Soham, would you add something to the search?
I use the same about advanced search. That gives a lot of freedom and a lot of customization also. You can really pick and choose like the term existing in the title or a particular author or maybe a particular publication type.
Yeah.
And the other thing is, yes, particular journal also. And for the citation manager, I have been using Mendeley from the days of my thesis days. That was introduced to us in Arvind. So it does an excellent job of citation manager, and also you can archive your articles also. It does a very good job of managing the various PDFs that you're collecting for your own reading also. That's all I would like to add.
And sir, any other, sir, Sabyasachi sir, do you want to add something, sir?
No, nothing. Discussion on literature search. I think everybody is benefited out of all these discussions. Go ahead. Go to the next one.
Okay, so we'll go to the next topic. And the topic is by so our next speaker is Dr. Jayant Kumar Das. Is there? So Dr. Jayant Kumar Das is a DO-DNB and PhD, is a prominent ophthalmologist of East India. He is one of the few eye specialists of the country and Northeast India to acquire a PhD degree in ophthalmology, I think, which is very, very rare. Doing a research and going ahead to get a PhD is a tough task. Presently, he is working as a senior consultant at the Retina Center and Eye Care Center in Guwahati. He is currently serving as the Joint Secretary, Ocular Trauma of India, Treasurer, Oculoplasty Society of India, Executive Member, Oculoplasty Society of South Asia, and General Secretary of Ophthalmic Society of Assam. I think it's a phenomenal achievements and phenomenal responsibility. Jain sir, over to you.
Okay, thank you for your. So all my previous speakers, Biswas sir and Santosh sir already mentioned, Meiti also mentioned lots of the things. And Biswas sir rightly mentioned, for a researcher, the ultimate goal is for the publish, the article should be published. Yes, it's 100% correct. But sometimes there's a big questions from among the students, because in our country, in developed countries, and in other developed countries, there is a big questions that what we'll do, what will be the outcome of the research. There is a big questions. People are not motivated for the research. In such scenario, that my answer is that, so that I motivate my students like, so you can learn, you can do some work, and it may help you in your day-to-day activity. Day-to-day activity in our practice, some of us may in a position to hold some position for a management point of view, if for to run a hospital, to run a setup. So in such scenario also, research are very much essential. So I'm very much thankful to all the organizations, Subodhita, Sebasasi, my friend Sebasasi, for allowing me the types of the studies. Okay. Research methods are classified based on different criteria. There's a lots of criteria. Lots of authors, they are telling different classification, different types. One is for all of us, it is a general category. That depends on the nature of the study, the purpose of the study, and the design. Also, there is interviews of case studies. So that interview is a very crucial part for management point of view. In some researchers, more than 2 methods. There may be a 1 method, there may be a 2 method, or there may be a multiple method. There's a combination of methods. So there is no such clear-cut guidelines, though this study may be there. Types of the research basically or studies classification on theoretical research. And on one is, as I already mentioned, there may be applied research, exploratory, descriptive, explanatory, qualitative, quantitative, and experimental. So many studies are there. But overall, understanding the research method, it is important to verify and validate the research in different fields. There's a lots of fields. And what are the goals of that? Important step to for successful studies, and one is set a clear goal, clear view about your target. This is your aim in each and every. We are whatever for a case study, to submit a abstract. Those are we have a clear view on your target. Know what you want to explore. Take help from the experts. From experts means I already mentioned all those are methods to how we can search for studies previous, or those are the experts. Nowadays we are online experts. Consider the best way to get your goal. Do the survey effectively. That's a very important. And thorough analysis uncover the wider implication. Again, there is 3 different. There's a lots of studies, but those are the 3. One is exploratory, one is descriptive, and one is casual. So in case studies, etc., those are the we are going to publish, or we are in casual. Some are we want to explore. We want to explore few new things. There may not be so much guidance from our previous researchers. We can explore, or sometimes we can describe it. So on that category, there is 3 methods: exploratory, descriptive, and casual. If we want to state what are the types of research, if we consider only the types of design, according to the design, again, exploratory, descriptive, explanatory, and evaluation research. What is actually exploratory type? This is one of the very important for a new research. Just as the word implies, it is explores. What is to find out about something by answering the question in your mind or from the others researchers. What and how? This is the very, very innovative type of thinking. This is the innovative studies, or if you want to explore in new, this is an exploratory type. So in our 2 components, what and how. So on that basis, all those big researchers are behind on these 2 points, what and how. But yes, there is in the book, so many things are there. But what are the recent trends on the research? Recent trends are in applied research. Again, I am telling quantitative research, qualitative research, experimental research, and non-experimental research. Some are non-experimental also. and confirmatory research. So if we want to confirm some of our work in a drug studies, others to confirm, verify, it is a confirmatory research. But based on the general category, but in most of the time, those are the as a whole in a nutshell, in total, based on the general category is one is quantitative, next one is qualitative, third one descriptive, analytical research, applied research. This is very important for our, those are not to motivate the people, those are not interested for research, not interested for publication, then though at least you can try for your applied, for your knowledge, for your things. We can go to a journal and your technique you can adapt, you can safer technique, you can help for your setup. And fundamental research, conclusive, and survey. Survey and case studies are very, very important for our practical life also. That survey will help to our day-to-day practice also. That's why I want to say one, what are the practical classification of those research? One is applied, definitely. Everyone can do it. So that's why it is in top, applied, everyone. So day to day, we are also exploring how many patients we are getting, what are the paying capacity of that. If your counselor is looking for the IOL pattern, so this is a applied. You want to apply his research, you want to use all base, and accordingly collect this data, he distributed all. We explain to the patient also a one kind of research from the research point of view. Then quantitative, qualitative, experimental is not. It is from by the researchers, who researchers, and non-experimental maybe from other reviewers stand, but all are exploratory. So now I want to say a few points. Those are not too much think. So research is for a few people, not for. But I think research for everyone. At least one part is I want to highlight, that is market survey. It is an important types of tool for market-related research. Apart from survey, other tools are interview. It may be suppose you are talking with your headman in your catchment area or some other influential people. That's also one kind of interview with the patients during the time of examination. We are exploring so many questions. We are asking to pinpoint our diagnosis. That also a kind of research. Interview, focus group. Then you can think, most of us, we are discussing how many patients we are dealing, what are the things with our secretaries, with our administrator. Those are a focus group. Those are also a kind of research. And observation. Then on that basis of observation, we can go. I am highlighting all those points to motivate our few students. Those are not at all interested for any research, but we are doing research each and every day in our practical life. Aim of the studies for any research is to pinpoint the need. What is our need? What we want to explore. Then analyze your performance. In our everyday, we are performance. We are seeing. So if someone is asking to his receptionist how many patients today, OPD, how many OP, how many. So that's one kind of question related to our research. Analyze your performance. So you can analyze your performance, your other doctors, your friends' performance. So unknowingly, we are doing some research. Target for continuous improvement of your performance. Suppose I am a cataract surgeon, I am a oculoplastic surgeon, so I am doing some cataract. So after 1 month, I did 100 cases. So how many rand, how many things, how many multifocal we are giving, those are also a kind of a research. So performance for our betterment, for the patient's benefit, all. So there is a exploratory. Exploratory, it is an important component of any market-related research. So this is basically a business-related research. We are doing this and every day. Though people are telling, I am not at all interested for anything Then I told, are you asking that question to your juniors? Are you asking to your secretaries? Are you asking to your receptionists? That they told yes. Then you are also doing a kind of research. So why you cannot follow? You can try to all. You may submit a case, also a kind of research. So proper methodology. It is a focus on discovery, the ideas. It is studies as a beginning of your setup. For suppose for youngsters, those who wants to start, how I can start. So you can also depends on your previous. You can collect some data of your seniors, and you can explore of the locality. Those are a kindly a type of research commonly used for further defining issues for your setup, identify areas of potential growth, alternative course of action, and prioritizing your need. Another very important for our day-to-day survey monkey audience. So I'm not going too much of those theories. So I just try to stimulate all our audience to day-to-day activities. We are looking, we are doing always knowingly, unknowingly lots of research. So our each and every moment are on the base of science, and we are every day we are exploring. Those are the research. Application of the market service. Test your hypothesis to view full or clear picture. Widen your view to gain quantitative and qualitative insight from the survey. Personalized service. Maintain highest standard for good outcome. This is the 4-hour survey level, whatever the way. If someone is tell, I am not at all interested for, but please go and to maintain for your service, for your survival, highest standard for good outcomes from your patients. Also a kind of, so you are analyzing your fault, you are improving, you are watching the videos for whatever the may be a cataract. You may ignore the other videos, but you are doing some work, so please do. Then another is that for all types of researchers, we need some professional services. Expand your access to the customers. Good public relation for superior than advertising. It is far superior than advertising. Serve your customers in totality. Elevate your reputation pattern. Patience-friendly behavior. Also, you can analyze your that once moment you can experience. You can analyze your. So I am like talking in such a way. So that's also another point of your observation. So it is an observatory kind of research. I am just giving some few small practical example. And what is our target for the research? Invest your time and resource with actions. Program for building, utilizing, expand value of your work. Utilize the opportunities, whatever is available. For those, some deciding factors are there. Look carefully to your seniors or previous data. As already Maiti is mentioning, those are points we can go for it. Let's say some are asking, so which one you are you PubMed or in Google Scholar, whatever, all are related to these things. But you can a small data which is not published, which was not in a rough written format. Also, we can explore all those data and we can do some study. Thank you.
Thank you, sir. Thank you for extensively covering all the researches. It was an enlightening experience. I never knew, honestly speaking, I never knew these type of researches were available because I used to publish, but I never knew that so many types of researches are there. Any questions from other panelists? Soham, do you have any question?
No, sir. No questions.
Santosh, sir? Santosh, sir, any questions?
No.
No, not really. We completed it, covered everything.
Okay, there are so Soham will go to the next presentation because we are running short of time.
Right.
And so can you introduce the next speaker, please?
So our next speaker is Dr. Chaitra Jaydev. She is currently the head of the VR services at Narayan Nethralaya, Bangalore. And she currently holds the post of Joint Secretary of AIOS, the Joint Secretary of VRSI, and the Chairman of Scientific Committee of the Karnataka Ophthalmic Society. She has published over 140 indexed articles and has the distinction of doing a PhD from the Maastricht University of Netherlands on pediatric retinal imaging. Madam, over to your talk, please.
Thanks, Soham, for that kind introduction, and thanks to Team EIZOC for this opportunity. And being a member of EIZOC, I consider it my privilege to present at this forum. I'll be speaking on the power of a case report. I think this low-hanging fruit, as most of us would like to say it. After a letter to the editor, I think the simplest other article to write is a case report. So let me go into why we need to write a case report and how is it going to be a stepping stone for us, no financial disclosures. Now, before I really go on with the talk, I think we also discussed a little bit before Dr. Honavar saying that not all journals publish case reports, and some journals publish only case reports. Now, why is there these two extremes? That's what we'll be seeing at the end of the presentation. So ideally, a case report should be unreported, or it should be an unusual side effect or an adverse interaction involving medication. So because you're not going to have too many of these cases. So either you put it as a case report or as a case series, and as the journal's requirement varies, the number of cases in a case series also varies. Some of them ask for 6 to be a case series, some of them will ask for 8 to be in a case series. So ideally, anything what the journal puts in a definition is your case series. Now, and since you cannot have too many cases, you have to put it into an original article, you put it as a case report or series. They could also be unexpected or unusual presentations of a disease. They could be new associations or variations in the disease process, presentations, diagnoses, or management of new or emerging diseases, like many things that came about during COVID. Initially were case reports, because the minute people started seeing something new was happening with this pandemic, they started writing it up, and the journals were very happy to take it because they wanted to be the first to report something new. An unexpected association, also something that we've not read in the textbook so far, but we're seeing it, and we know that it could help in either further management in terms of diagnosis and treatment. An unexpected event in the course of either an observation or of treating a patient. This could either be an unexpected benefit from that medication, or it could be an adverse effect. Findings that shed new light on the possible pathogenesis of a disease, something that we've probably not known, but now with the findings that we have seen, we know that this could be the reason. So the value of a case report is that it describes important scientific observations that are missed or even undetectable in large trials. So many times, it just goes missing. So this is the value of a case report. Now let's look at some of the examples. Now, a case report links the FDA-approved anorexic agents with primary pulmonary hypertension. So this is what the trials evaluated: only the incidence, the mechanism, and the risk factors. And then there was withdrawal of the drug from the market. So this is the first case report which eventually led to withdrawal of the drug from the market. So that's how important they can be. Now, this is a case report of a Kaposi sarcoma in a young man, which eventually gave us AIDS. So, if this had not been reported, maybe that much of importance wouldn't have been given, and people won't have gone on to do more research and come to, final entity called as HIV or AIDS. It's also the first line of evidence for new therapies, whether it was physostigmine in myasthenia, potassium iodine in erythema nodosum, TNF-alpha antibody treatment in psoriasis, dapsone and Behçet, insulin for type 1 diabetes mellitus. All of them have been through case reports. Even rare indications, difficult to conduct trials with adequate sample and power. So you can't really be doing, trials and original studies when the disease itself is very rare, and the treatment therefore is only restricted to that study group. It's also difficult to get funded by pharmaceutical companies when they know that the reach is going to be a very minuscule population with rare diseases. So then the pharma never wants to really invest or sponsor in these trials. In 1995, mycophenolate mofetil was approved in the US and UK for immunosuppression after renal transplant. Likewise, in 1997, off-label use was reported in pyoderma gangrenosum, autoimmune anemia, pemphigus vulgaris, bullous pemphigoid. So it just starts off from one small thing, and now we know that even though the group of patients with these conditions probably are very, very small, the drug itself is very, very important to them. Even the side effects of several drugs were described originally in case reports, whether it is anti-TNF antibody for vitiligo, interferon alpha, like I mentioned, IV immunoglobulins in patients with even stroke. I think that's a lot of them are doing it now. So what is in it for case reports for the authors itself? It's an opportunity to publish. It's very easy to write. It's a good learning practice. And false alarms can be raised. That's some of the biggest drawbacks. Just because one or two people saw, an adverse effect, it could be a trail of events leading to false alarms. Like, for example, Demendox or Benectin, with a combination of Pridoxin and doxylamine, was marketed for morning sickness in pregnancy. Based on these reports of malformations, it was withdrawn from the US market. But then in Canada, it was continued to be used, and they never found any evidence of human teratogenicity. So, like I said, one or two reports could raise a false alarm, and that can be quite, worrying. Also, readability is high, and they can be quite influential, as even being withdrawn from the market. But when it concerns editors, it's less citable. The maximum being for meta-analysis and the minimum being for case reports. It reduces the impact factor, therefore, and hence editors do not really like case reports. I hope Dr. Honavar is not listening to me. He doesn't like it in the parent journal. Hence, he started a new journal, Indian Journal of Ophthalmology, for case reports, which I'm sure in the years to come, it is going to get indexed as well. So quickly going into the case report structure, you have the abstract, the introduction, case description, discussion, the conclusion, and references. This can vary from each of the different journals. Some of them have different formats. So all the more important that you read the instructions to the authors. Abstracts could either be structured or unstructured, and the word count is also very, very important. Some of them can be as brief as 500 or 600. Some of them give you even 2000 word limit. So the introduction should describe the subject matter, provide background information, pertinent definitions, describe the strategy of literature review. Most of us say, to the best of our knowledge, literature did not reveal any similar case or association or adverse events. So these are some of our, commonly used phrases when we're writing single case reports. Justify the merit of the case report by using this literature review that you've already done, and make the introduction brief. Don't keep it too long drawn. 3 short paragraphs or 2 short paragraphs are more than enough. So case description is very important. You describe the case in a narrative format, provide the demographics as such as the age, gender, whatever is relevant to that particular case. I avoid patient identifiers. It could be even simple initials also. Sometimes it's really not required. Describe the patient's complaints. One journal that I've been writing to recently, they don't even allow us to give the exact age. If it's a patient who's 52 or 53 years old, they say, they want us to write it in such a way that a male around 50 years of age or between 50 and 55 years, they don't even want us to give us that much of a patient identifier. Describe the complaints, list the present illness, any relevant medical, family, social history, and also their medication history if it is relevant for this particular case report. Now, anytime you're using a patient photograph, you have to take permission, follow the institutional guidelines, ethics guidelines that you have, provide the events in chronological order, ensure a temporal relationship and a causal relationship, and ensure that the case presentation provides enough detail to the reader to establish the case's validity. Now, coming to the discussion, explain or justify the similarities and differences in your case report with the available literature. Say this we saw, whereas that was described in that particular case or that particular series. List the limitations of your case report, if any. Do not have to make a big deal of the limitations because it's only a case report. At the most, you can say that, we were unable to get follow-up scans, it would have been nice, or something like that. And maybe the follow-up scan could have shown us the decrease in the edema. You give the relevance of why this follow-up scan could have helped better. Summarize the salient features of your case report and justify the uniqueness. Draw recommendations and conclusions. If you can say, this case report throws light on this, and this is probably a possible treatment option, I think it will be good for the reader to have gained some knowledge. And therefore, the conclusion, give a justifiable conclusion, evidence-based recommendations, besides your case, also what does evidence show? Describe how this information learned can apply to one's own practice. Opportunities for research, like, we need to include a larger sample size across different probably population groups to get a better idea. Ensure that this section is very brief and does not exceed one paragraph. Now, your checklist for case reports, abstract should summarize the whole case. Introduction should give you a rationale substantiated by your references, a brief, adequate, and clear description. Investigations, try to mention the normal values for uncommon ones, because most of us don't even know even for the common ones very often. And then the diagnosis and recommendations in your discussion. This time, and emphasizing, because case reports, a lot of value is added because of the clinical photographs that we use, to not put in the name, the MRD number, or any other identifiers. Photographs should ideally have their eyes closed for identity, but because we are ophthalmologists, we need the eye seen. So I've seen many photographs wherein the mouth is covered. Sorry, that does not hide the identity, no amount. You can crop the photograph as much as possible just to show probably the one eye that's involved. And if you think you cannot hide the identity, please take a separate consent form. Journals will ask you to submit the consent form either before the process or after the acceptance. Disguise any identifying information, like I said. It's better to take before writing and submitting the manuscript, because after writing and submitting, if it is accepted, the patient can still refuse and you will not be able to publish a paper. So written informed consent, it will eliminate any such risk. It protects the authors, the journal, and the publisher. Special consent required if identity is revealed. So these are some of the journals for case reports exclusively. And if you can see the VMJ case reports that Dr. Honawar was talking about, our institute has a subscription with them where we're publishing a lot of case reports. I think that's one place that you can explore. And then, of course, our own Indian Journal of Ophthalmology case reports. A lot of us are publishing in that, and we know that the indexing is not far off, and even retrospectively, like Sir mentioned, all these articles published in IJO case reports will also be indexed on PubMed soon. So these are the care guidelines, or the case report guidelines. This is a website where you can download this form. It's quite useful to ensure that you've not missed anything. So this is how the checklist is. It helps to ensure that you've complied with all the requirements for a case report. So to summarize your important brief reports, the quick to write, slow to publish. I have one case report that I've been trying for the last, I think, 3 or 4 years to publish. I've had at least 7 or 8 rejections, but I live in hope, because I think that the case report does have some merit. It's a good beginning for beginners because it's short. You get rejected pretty fast. So, you can improve on your paper quickly and submit it again. And expertise and resources are not major requisites, because you don't really need to do stats. You don't need somebody to do a lot of the formatting for you. You yourself can do most of it, or your colleague or your co-author or even your spouse. They're pretty good critics. Learn from small mistakes to make it big. But I must say, since a lot of case reports do carry color photographs, many journals charge for pictures. So please ensure that you read the instructions on color processing charges or APC before submitting to these journals. Thank you so much. I think I'm done.
Thank you. Thank you, Chaitra.
Thank you, ma'am.
It was an extensive presentation on case reports. Case reports are very, very important for all the beginners who are first-time authors who don't have a knack of writing, who don't have an understanding of writing. The case reports helps you to write, helps you to understand what to write and how much to write. And once it gets accepted, it gives you a motivation and stimulus to do other researches and write extensively other things. So it's better for all the postgraduates, whatever the cases they see. No doubt, it may be a simple observation, but it may be a complex observation for others. So if you feel that it is something worth telling, it's better to write, right? So Soham, do you have any comments?
I think Dr. JB sir's talk in the very beginning shows us the importance of writing case reports. He described so many unique and first-time uveitic features. So I think we should be really on the lookout for any of these unique cases and be sure to document it well, and eventually at every opportunity possible, publish it.
Yeah, I think, Sohan, the keyword here is document. Now we all have smartphones and fancy, imaging devices. I think when we were postgraduates, it was really difficult to actually put them together. I remember still writing it in a diary. I think that's not even required anymore. Most important is to just quickly take your MRD number and tag it to the photograph or a scan or something that you're even seeing on your screen. You'll never know. You'll see 3 or 4 similar cases you can put together and publish them. I think that's the most important thing that I keep telling my residents as well, that if you don't, actually write down or note down which is an interesting case, it could be simply a nice photograph of a patient's fundus, which shows some very unique finding, and that itself can be published. So as a photo essay or a case report. So I think that's key here, because no matter how young and how intelligent you are, you may not really remember case details and to go back to in your MRD or your physical files to find the information.
And nowadays we have a lot of good mobile cameras, good cameras with good attachments. So you need not have a fancy instrument to take the documentation. Now certain attachments are available which are very cheap. I have an attachment which was been innovated by my friend, and it is attached to, it can be attachable to any smartphone, and you can fix it to the slit lamp and you can take very wonderful photographs, and these photographs are very well acceptable. So you need not require a very higher end machines like 3 lakh, 4 lakhs. You can have a simple attachment with your mobile phone and you can have wonderful photographs. Any other doubts and any other observation or any other, somebody wants to contribute? Dr. Santosh Mahapatra, do you want to tell in something?
Comments from Dr. Ajit Babu, sir.
Ajit Babu, sir.
So whenever you are doing case reports, try to be presenting a unique cases, because that's what carries a lot of importance. Case reports never underestimate with case reports actually. We all published very limited number of case reports, but they have led to study later on.
So we'll go to the next talk. And the next talk is from Dr. Manavi Sindal. She's from Maharashtra. And she did her MBBS from State GS and KEIM Hospital, Mumbai. She's did her fellowship in Arvind Eye Hospital, and she has been associated with Arvind Eye Hospital, Pondicherry since July 2009. She has been working along with the institutional mission, because I am an Arvind alumni, I know, to eliminate the needless blindness. Yes, and she has 13 peer-reviewed publications till date. And she has been doing extensive work on retinopathy of prematurity. Over to you, madam.
Thank you all, and thank you for inviting me to shed some light on the use of, on the writing of an original article. I'm just going to start my slide share. So how to write an original article? So this is probably the crux of what we all want to do. We want to write nice, good papers. And I'm going to concentrate more on my talk about how do we actually write the paper. But what we should remember is that there's a lot of background work which goes in before one actually comes to the stage of writing your article. It begins with devising or designing a good study. This can be either a prospective study or it could be even a retrospective collection of data which is already there in your medical records available. You have to have a good hypothesis. You have to collect your data in a very systematic manner, making sure that you're collecting everything that is essential. Following this, you need a good statistical backup. Your statistician has to do a great analysis for you. And only after that can you move on to the process of actually writing your paper. So what are the components of an original article? So you of course have the title with the running title and keywords. you have the abstract, and then you have the main body of your article. So I'll first talk about the main article. So this first thing that you should know is every article before you write and when you complete writing and before you submit, you should be looking at these equator reporting guidelines. These are structured guidelines which are meant for health researchers when you write a manuscript, and they are meant to be make your manuscript in such a way that it can be understood by the reader, replicated by somebody else who wants to do a similar study, can be used by a doctor to make clinical decisions, and it can be included in a systematic review. There are various checklists available for the different types of articles, like you have the consort checklist for randomized clinical trial, you have the STROBE for prospective studies, and you have record for retrospective studies. The Indian Journal of Ophthalmology author instruction actually has a fantastic table, and that table enlists these checklists, and the checklists are available at the Equator website. And a lot of journals do require you to submit these checklists completed when you are submitting an original article. These actually following these guidelines when you write your manuscript, make your manuscript very strong, and they cover all the points which are required to, and it really helps you in writing. It may feel when you go through it, especially as a beginner or writing it for the first time, that there are so many points. It really makes your manuscript really good. A typical manuscript will consist of an introduction, material and methods, results, discussion, and then the references. The introduction to a manuscript should be succinct. It should be to the point. It should drive your manuscript's importance home and should not be very long. It should be about 2 or 3 paragraphs, the beginning of which introduces your topic. The second one provides background to what you are planning to address in this manuscript. And finally, it concludes, the introduction concludes with presenting why this particular study. So if you look at this short introduction from the manuscript on traumatic retinal detachment in pediatric age group, the first paragraph talks about ocular trauma and about the incident of ocular trauma in children. The second one talks about what is retinal detachment in the setting of trauma and how it has been reported. And it concludes with the purpose of the study. A brief introduction that drives the point home. Sometimes we will be talking like this is a topic which still has a limited scope. Sometimes you may have topics which are very broad and wide. You may be talking about something related to diabetic macular edema, and there's like immense amount of literature available on diabetic macular edema. You have so much on its pathogenesis. You have so much on its classifications. There are so many different ways it's classified. With the newer studies, you have OCT findings in DME, and then you have treatment. You just need to address that particular amount or into your introduction, which is relevant to what you are presenting in your manuscript. Then you come to material and methods. This is the core, first core of your manuscript. This is where you describe what you actually did. Typically, the first paragraph of your methods, material and methods starts with stating what kind of a study it is, whether it was a retrospective, prospective, or a cross-sectional study, or what it might be. You have to have a sentence stating that it adhered to the tenets of the Declaration of Helsinki, and you have to have a statement which shows your ethics committee approval. A lot of journals may also require you to cite your ethics committee approval code or identifier, and these are mandatory by most journals. Following this, your material and methods have to describe how you sourced your data. So if it was a prospective study, what was your study population? Where did you recruit these patients for? Which were the patients that were recruited? Here is where you present your inclusion and your exclusion criteria of your study. You have to say what all data that you collected. So in this, what I would like to point out is many times when we actually collect data, we collect a lot of things. But in that particular manuscript, you may be presenting a certain subset of that data. So be sure that you are mentioning that data alone as this was the data that we collected. If you're describing any procedures, these need to be described in detail. So if you are talking about a surgical paper, you need to describe the steps of the surgery in such a way that somebody else can also be able to perform that surgery by looking at your description. If the paper really describes a new surgical technique, it's a good idea to have a supplementary video along with it. If it's a paper on imaging, you have to describe what was the imaging protocol used, which was the imaging machine used, what were the protocols used, how were the scans observed, and then how was this data or these images read by the person. If it's a paper on treatment, you have to describe what was your treatment protocol. even if you have followed the standard treatment protocol as described in literature or what may be considered gold standard, you still need to talk about this. Like if you're talking about retinopathy of prematurity, we all know you're going to treat type 1 retinopathy, but you need to mention that when the type 1 retinopathy was noted, it was treated with laser or anti-VEGF or whatever it may be in relevance to your study. So here I have an example of the methods of a paper which gave the validation for a smartphone-based fundus camera versus a standard desktop fundus camera. And here you can see the participants who were the people or the population recruited is described. The sample size calculation, this is another important point in the study. You have to show how was your sample size calculated. This will be provided to you by your statistician at the beginning of your study, obviously. Then it involved an arm of clinical assessment. So how were these patients assessed clinically? How was the fundus imaging done? And how were these fundus images then interpreted or graded by the graders? All of these different parts of the methodology of the study have been described in detail. Then after your methodology has been described adequately, you come to results. Now this results is the main crux of your manuscript. This is where everything lies. It needs to be supported by a good, strong data, which has to have an excellent analysis by a good statistician. If your statistician needs to be guided by you as to how you want the analysis to be run, what are the different parameters you require analyzed, because most of the time statisticians are not clinicians, so they don't know what compares to what. And this is where we need to tell them what you want compared and how you want it documented. It is also here that you may incorporate your relevant flow charts like the consort diagram, which is required in a prospective randomized clinical trial. This is, of course, a retrospective study of ours, which we did about babies which received bevacizumab for retinopathy of prematurity. And this is a diagram which shows how many babies were screened, how many babies received bevacizumab, how many were recruited into the study, and the split up of what happened to them in this group. This is something that can go into your results section. The results typically include tables and figures. Most journals limit these put together to a limit or a number of 5. Tables, typically, most often your first table is going to be one of demographics, where you will enlist the demographics of your entire population. And usually the last table would be that of the regression analysis, especially if you have multiple points in the regression analysis. If your regression analysis just has 1 or 2 points, then it need not go into a table, it can just go into your descriptive part of the results. Then there are figures. You can use various graphs over here. These graphs can sometimes highlight or represent the data in a much more simpler and a more eye-catching manner than either having it described out in a long sentence with a lot of numbers and percentages in it, or having a table over there. It also makes your paper more interesting. So if you are really just presenting data, rather than having 5 tables, if you put a couple of those into graphs and you have a remaining 3 in the form of table, it just makes it more attractive also. And of course, when you are talking about a paper or a manuscript where you are talking about some imaging findings or anything, those themselves form a very important part of images. So if it's a paper that's purely describing some imaging findings, you will have just multiple figures which are actually like OCT images or slit lamp photographs or B-scan images relevant to that particular study. And then you have your descriptive results, which is what builds all of these tables and figures and everything else together, and provides connections and gives a flow to your data. The descriptive results should not repeat what is already written in the tables. It should introduce your table, it should highlight what is in your table, or introduce your figure and highlight what is there in the table, and also write about those few points which are very important in your data, but are not so much that they that don't find a place into any table or a figure. So here are a few examples. So this is a table of demographics, a typical table 1. This particular data had the population divided into 2 subsets. There was one in which we had sutured and sutureless scleral fixated IOL, and the other subset was where the aphakia was caused after trauma, or it was as a result of aphakia due to complicated cataract surgery. And so we had these 2 tables which not only showed the various demographics, but included all the various details regarding the case, like their visual activities pre and post, what was the technique involved. So the sutured, sutureless one said how many were trauma or cataract, and the vice versa, and what were the previous surgeries done, and the final visual activities. All of this can be given in a very succinct manner into a table, which makes it very easy for the reader to compare and to understand and get these numbers out. tables should have the proper appropriate heading, they should have proper columns, and they should have a proper footnote which expands your abbreviations and gives an explanation for what is presented in that table. You have a regression analysis table where you can present your univariate and your multivariate analysis, and you can highlight those particular findings which were positive or important in this particular data set. And then you have your graph. So here, like if you look at the lower graph over here, which is this is from a paper wherein we tried to see what is it that brings patients with diabetes to a tertiary eye care institute, and here and what is their presenting complaint and what is the diagnosis at baseline. So here, if you look, we can see that a majority of the patients actually had diabetic retinopathy at presentation. Some and a majority had cataract, and there was the other one which had DR and cataract and refractive errors. These are the four main groups what brought a patient, whereas AMD, RVO, and all formed smaller. So this represented this data in a very eye-catching manner. You can just look at the graph and know where the population stands in this particular study. There's another where we had the complications in the traumatic retinal detachment in pediatrics, and in the different population in those eyes which had an attached retina and those which did not attach till the end, and how the complications went could be displayed very easily in this graphical manner. And then, of course, you have your clinical images. So in a paper which described hyperreflective foci in diabetic macular edema, we definitely need to have some OCT scans which show how and the different hyperreflective foci appear in the different layers of the retina, how they appear in the inner retina, how they appear in the subretinal fluid lining the cavity, and how they'll appear in the outer retina, and also how they can be distinguished from hard exudates. Or in the imaging trial, this is how the images were graded, or this is what was graded as excellent images. All of these form a part of your results and help you to showcase your results in a better way. And the results should be presented in a sequential manner, usually starting, as I said, with your demographics, then the data on what are your main study outcomes, which will be based on what is your main study aim or your hypothesis or your primary objective. Then going into comparison of any subgroups that may be present into it, then coming to usually complications, and finally a regression analysis which helps you correlate the different things in this particular data set. Following your results, once you have your results in place, you come to writing your discussion. A good way to have your discussion is have a good first paragraph which summarizes the main outcomes of your studies. So whatever has been read in the results where you have presented all of your results, here you summarize those points which are the highlights. Following this, you discuss each point in a sequential manner. Usually it is a good thing that whatever pattern your results followed, your discussion follows the same pattern. Of course, sometimes you join points together. Cross-reference with appropriate literature. Dr. Anirudh Maiti just now gave a fantastic talk on how to do a literature search. So now you have done your literature search, you have your reference points available. So you should cross-reference your discussion and your own results with appropriate literature search. It is important not to repeat your results in the discussion, but to compare your findings with what others have found in similar scenarios if present. Most journals for an original article allow 40 to 50 references, but usually around 25 references suffice. The referenced article should have relevance to your data in your manuscript. Normally, the way one would write it, the references or reference articles in your discussion would be to have some articles which are have findings or have findings which support your finding, and then you can also refer to some papers where the findings are contrary to your findings. Again, there'll be sometimes a lot of literature aware, like diabetic macular edema, are topics where you have a huge, immense amount of literature available. And in these cases, you just need to be sure to quote that which is really of relevance to your manuscript alone. After the whole manuscript is written is actually when you come to write your abstract. Though the paper that you read starts with an abstract, it is something that is written in the end. Most journals for original articles require a structured abstract. The subheadings you may differ from journal to journal, as do the word limits, but it is usually around 250 words, and most have the purpose, method, result, conclusion structure. The purpose should very nicely state what is your hypothesis or aim of the study. The method should highlight the crux of what you did in your methodology. The results have to put a spotlight on the main findings of your paper, especially the ones which make it stand out from all the other similar literature available. And the catchy, brief conclusion should drive your point home. And the keywords. The keywords are really the key to your article. As Dr. Maiti just told us, it is these keywords which are going to help in the searching in an indexed database. So see that you have the appropriate keywords, which ensures that your article will pop up or show up in relevant searches to that topic. These keywords also have limit. Usually it's around 5 to 7 keywords which you can use for an original article. Now, how do you go about writing the manuscript? So again, like I said, abstract comes later on. The order in which at least I prefer writing is I like to write the methods first. So the method is something I know. That is what I did. It is there with me. So I write down my methods first and describe it. Then I go and look at my analysis sent by my statistician, and I put it together and compile it into what is my results that I am going to have. This builds the basic foundation, strong foundation of my paper. And then I write the discussion and the introduction. There are sometimes a few points which you may sometimes feel they fit better in the introduction, and sometimes a few points which go better in the discussion. So that is the order in which I write a paper. And then comes the abstract and a title which would be there somewhere in your mind, but the final title of a paper can usually be only written properly after you have gotten all of your results in hand and you know where it is leading you. The title has to be precise. It has to reflect what your manuscript or your paper is about. And it should also ideally include the nature of the study, like a randomized clinical trial or a prospective study or a retrospective study, as may be the case in this scenario. Then, of course, journal submission. Once you have identified your appropriate journal, read your author instructions carefully, format your article now according to these author instructions. And one good thing is that once you have written your whole manuscript and all, you sort of put it away to sleep, or like the baker would like his dough to rise, or like the dosa dough has to ferment overnight. You let your submission sit. What happens is when you are actively involved in writing your paper, you are so involved in it, it's sort of, it's like you have learned it by heart, and you don't see things you're missing. You don't see errors you may have made. You may sometimes not even realize where the flow is not really there in your paper, because in your mind, the flow is there. You put it away for a few days, your mind gets refreshed. And then when you come back to it, you can find a lot of things that you would like to change. Believe me, when I read my articles, which have been published already and are there, and I go back and I see them and I think like, what was I trying to do here? Why did I write it in this way? And I'm sure everybody here is going to agree. You can always make it better. All your co-authors should see the manuscript. They should have an opportunity to put in their inputs into it. It's good to use track changes so that we can track what each person is saying. It's also a good idea if you have somebody who is not involved in the process of writing this manuscript to have a read of the manuscript and to give some suggestions, because a fresh look of somebody who doesn't know what all has been going on can really give you inputs about where some point may not really be clear or where your flow is missing and all that. So these are a few things which you can do to make your article really good before submitting it. And it is like this, by working in a step-by-step way and with good planning, that you can have the success of publishing an original article. Thank you.
Excellent talk. Excellent talk.
Thank you.
I think all the points have been covered extensively on how to go about writing a paper, an original article. And I really liked the minimalist style and color scheme of your slides also.
Thank you.
So any comments
so we'll go to the next step, because we are running a lot of short of time. So after the talks, we will have the discussion.
Okay.
Can you introduce the next speaker, please? So
Right. So next we have Dr. Rashmi Deshmukh. She did her ophthalmology masters from JIPMER and then trained at Narayan Nethralaya in refractive surgery, cornea and cataract surgery, and now currently is in LV Prasad. She has also done a clinical and research fellowship under Professor Dua at Nottingham University and a senior clinical fellowship in cornea and cataract surgery at the Cambridge University Hospitals. She has published over 30 peer-reviewed manuscripts and several book chapters, and sits as an active reviewer in various international journals. and also is an assistant editor of the refractive surgery and cornea segment of the Indian Journal of Ophthalmology and the editorial board of BMC Ophthalmology. Dr. Rashmi will be talking about how to write a review article. Please go ahead.
Thank you very much for that kind introduction, and excuse my voice, I'm not keeping very well today. So I'm just going to talk about how to write a review article. To begin with, why a review article should be written in the first place. It is a great thing for a young investigator. It involves a lot of work, but it also gives you an opportunity to dive into the most recent literature in your field and gives you a practice on reading papers and interpreting them, and requires synthesizing and organizing large amount of information from all the original articles that you are reading in order to write that particular review. Writing a review is not only a service to the scientific community, but it also helps in advancing your own career because it is one of the most cited articles. The purpose of writing a review is to clarify the knowledge and explain the contradictions on one particular topic, and then create a consensus on that particular issue that you are writing about. While writing a review, it makes you a master of that topic, and it helps you develop a synthetic thinking. And it is also useful in situations where you're not able to publish original work. Like, for example, when the COVID situation had happened and trials were not going ahead and it was difficult to publish original articles and case reports. These are the times when review articles can be written, and it adds to your CV as well. What is the goal of writing a review? It is to synthesize the recent and primary literature available on a topic. These days, on whichever topic we look at on PubMed, there is a huge proliferation of papers, and it is very difficult to pull together and summarize all of them. And that is what the goal of a review is. And it is also aimed at giving a good sense of the field that you are talking about, address all the controversies that are there between the different studies, and give a comprehensive list of all the references that have made an impact. Now, broadly, there are two different kinds of reviews. One is a narrative review, also called as a literature review, and the other one is a systematic review. So in a narrative review, it's more of a qualitative review to summarize important aspects of a particular topic, but there is no listing of methodological approaches, and it's only a critical analysis of the literature that has already been published. Whereas a systematic review in itself is like original work. So it is a well-planned review to answer a specific research question. And in a systematic review, you're actually reviewing all the results of the original articles and then stating what the final conclusion is and arriving at a consensus. And because it is considered as an original work, it does require a rigorous methodological approach, which needs to be described. For the purpose of this particular talk, we will be focusing on narrative review. So in narrative review, I'll just talk through how we choose a topic and how we get it to publish. So while choosing a topic, we need to make sure that it is a topic that we are interested in, because there's a lot of reading that is required, and it is difficult to read up hundreds of articles on a topic that you're not particularly interested in. Then again, it is important that the topic should be current and well established. It should not be like a rare topic which nobody is interested in. It should be a topic which is very frequently seen by clinicians and practitioners. And there should be enough research studies on that topic for you to review. And again, it should be a topic that interests your readers as well. So for example, it could be a specific aspect of a very broad topic. So a broad topic, the example I've taken is like penetrating keratoplasty, but there could be specific aspects of PK that you are reviewing. For example, just the non-circular PKs, or here it is a review on just pediatric transplants, or infectious keratitis following a keratoplasty is a specific aspect of a very broad topic. That could be one thing that you could do. Second thing is to update a topic of interest. For example, there is a topic which has been updated a few years ago, and after that there has not been a recent review, but a lot of changes have taken place over time. So that is something that you could do again. These are the examples that I'd written on just as updates on topics of interest to summarize the current literature on it. And then sometimes you could also choose a topic which is interesting for you, but nobody has reviewed it yet. For example, laser-assisted keratoplasties was something that I'd written on. And again, while I was with Professor Dua, then we had written on use of alcohol in ophthalmology, which was not a topic which was reviewed in the past. Once you have chosen a topic, then comes the literature search. So what are the authentic sources of literature? It will usually be Medline or PubMed or Embase, Google Scholar. Usually previous reviews or peer-reviewed research articles is what you want to look at, and not sources like Wikipedia or any blogs or something picked up from social media is not an authentic source of literature that can be cited in a review article. We have already heard from previous speakers about how to search literature, but this is just an example of how important it is to choose your keywords. For example, again, if you just look at the different results we have got when we've used corneal transplantation versus corneal transplant versus a keratoplasty, although they all mean the same thing, the results are quite different. The articles that would come up would be quite different. So one needs to make sure that all the kinds of articles are what you have looked at. We have already heard about Boolean operators. So in the interest of time, I'm skipping this and mesh as well. So once a literature search is done, then critical analysis is what is required. So you have pulled all your articles together. After that, what you need to do is the inclusion and exclusion of articles based on the weightage that they provide to your particular review, and then group the articles according to a particular theme. That is something which helps me as well. So you could, if there is a very broad topic, for example, phototherapeutic keratectomy, then you could group the articles into subheadings, like some articles describing only the indications where it has been used, whereas some articles are describing the side effects of PTK that have been described. So grouping the articles is something which helps quite a bit. And then deconstructing the topic, like I was just mentioning, into some of the basic ingredients. Then you should also identify any outlying ideas and whether these are of any relevance or any significance at all, and whether it is important to highlight these outlying ideas, or is it just a one-off thing which can be ignored, is what you need to judge. And then what are the key results or methods and interpretation of all these articles that you are reading. So it is not a mere description of the articles that you need to write. You just don't need to write that so and so et al. Did so and so and found this in their study. That would not be as relevant as grouping most of the articles and forming a conclusion and then describing what you are taking away from those studies. Use of high quality evidence is again something which is very important, which brings us to the levels of evidence in evidence-based medicine. On the top at level 1 is usually systematic reviews and RCTs. And as we go down at the bottom, we have case series and case-based reasonings or expert opinion. At level 2 are some cohort studies or case original articles, and then case control studies, and level 4 is the case series. Once the critical analysis is done, you need to decide on a particular journal. So there are different kinds of journals that are available that would accept your reviews. Some of the journals have invite-only basis reviews, so they will not accept a proposal. But in some of the journals, you can write to the editor and submit your proposal saying, this is a topic which we would like to review, giving a brief summary of your outline and the references that you're going to use. So again, while submitting to a particular journal, it is good to see the readership of the journal, what is the impact factor, and what are the different perspectives of the previous articles that have been published by that journal. And again, the policy of journal could be either by invite only, which usually goes to very senior authors, or some of the journals might accept it as a proposal, which again goes through a review process sometimes. Then inviting co-authors is usually a good idea, especially if there are authors who could provide some expertise on the manuscript development and make some substantial intellectual contribution also. So somebody who is an expert in that particular field, you could collaborate with them. But the important thing is that they should be willing to devote their time to writing and reviewing the manuscript and participating in any kind of group meetings that you might have regarding making that, writing up that paper. And they should be able to meet the timeline. Then next is how to write a proposal in order to send to a journal. So in a proposal, what you need to cover is why is your topic worth reviewing, whether it is an absolutely new topic or whether the last review that had come on that particular topic was very long back and now it needs to be updated, those kind of things. Then has there been a previous review, something which you should mention, including when it was and what was lacking in that. What are you adding to literature by writing this particular review? And then give an outline along with the references. And this is an example of how an outline is written. So basically you deconstruct your topic into smaller subheadings, very similar to how you would frame it in your head or how you read a book chapter, something similar to that. And then write all the headings and then start giving at least the main references, if not all. Then comes drafting your manuscript. So when you start drafting your manuscript, it is very important to just follow the outline that you have provided the journal with. It makes your job much easier. So in the introduction, you basically write the purpose of the review and a brief overview of the problem that you're going to address by writing this review. Whatever literature is already available, including the historical data, it is a good idea to include that, and then mention about what your article is going to add to literature that is already existing. By reading your introduction, your reader should get a sense of what he's going to gain after he reads the complete article, because reviews can be very extensive at times. And then one should also consider writing introduction after analysis of all the literature. So introduction and summary is something which you could put off till the end after writing the entire manuscript. Then comes your main body. In the main body, like I had mentioned, you need to present and discuss the findings from the literature, but avoid merely just describing all the trials and studies. You need to come to a take-home point from each article that you are trying to explain. It is a good idea to divide it into themes and categories, which is the most common approach in most of the reviews. The flow needs to be a little logical, and be sure to address all the contradictions and inconsistencies in literature. So when you're doing your literature search for any particular topic, you can identify, there's a likelihood that you would identify some lacuna in literature, and you could provide an explanation for that particular lacuna if possible. And but there are some reviews which are also just give a chronologically presented data. I've given an example of this review on PAXI-XL, which follows this particular theme, in which they have just chronologically presented how PAXI-XL has evolved from being just a collagen cross-linking for keratoconus earlier to now being used for infectious keratitis. That is something like a short review. This could be done in cases where you do not have enough original articles yet, but this is a technique which has evolved over time. And then your conclusion. Again, conclusion is just a concise summary of all the findings that you found during your literature search, and it should offer a rationale for your future research in that particular topic according to you. If there are any gaps that were identified, they need to be highlighted during conclusion, or any recommendations or implications on your current practice and research if there is a way that the current treatment pattern could be changed. It should be in line with your introduction. Then very important to avoid plagiarism. There are different kinds of softwares which are available to check plagiarism at the like Authenticate or Grammarly, and it is a good idea to just use them so that plagiarism is avoided before you submit your manuscript. Then arranging bibliography is another important task while writing a review, because it is sometimes, some journals have at least a limit of references, but there are certain journals like say Survey, they don't have even a limit to the number of references that you use, and it can also reach up to 200, and it becomes very difficult for you to monitor all your references. So it's a good idea to use citation managers. I personally use Zotero, but EndNote and Mendeley are also quite user-friendly. So in Zotero, this is how you just arrange your bibliography. I've just given that example because I use it. So in your bibliography, once you have all the articles, then there is a plugin of Zotero in Microsoft Word like that. And then you can just go on add or edit citation, and you can add your citation there. And in the end of the manuscript, you can just add the entire bibliography. And then after your manuscript is ready, last thing to do is abstract. Just to talk about what is an abstract versus an introduction when it comes to a review article. So an introduction will provide the reader only with some background information about your topic and introduces the rationale for the paper. explaining and defining the problem. But it is very different from the abstract in that it does not give any information about your literature search and what you have concluded. It can either be structured or unstructured depending on the journal's guidelines. And then once you've written your abstract, then you just go ahead and submit your paper and hope that it goes through the review process. So the take-home message would be that the review articles are an important category of manuscripts, and the aim is to summarize the current knowledge in one particular topic. It is useful to the authors because it's one of the most highly cited articles once you write it. And it is also useful to the readers because it becomes like a one-point source of all knowledge on that particular topic. Thank you very much.
Thank you, Dr. It was a very extensive presentation about the review articles. So we'll go to the next topic, and the most important topic, last but not the least, and that's it's a very important because to do a research unless until you have the ethics committee, you cannot publish in any journal. So Dr. Sabyasachi Patnaik will be highlighting about the ethics approval and how to form an ethics committee. He is presently working as an additional Director General Health Services, Senior Consultant Ophthalmologist at Rourkela, Odisha. He has been trained in best of both worlds, that is Arvind Eye Hospital, Madurai, and LV Prasad Eye Institute, Hyderabad. He is instrumental in starting these ORTS programs and ORPI programs for his passion for teaching. And I have a personal experience with him, and he's a wonderful teacher. And over to you, sir.
So thanks, Praveen. Now, as we all know, ethics is very important in any profession. So also, for publication also, we have to follow certain ethical issues, because publication ethics ensure high quality scientific publication and public trust in scientific findings, and people receive due credit for their work they have done or the idea they have conceived and published. So there is a committee on publication ethics. This is an international forum for editors and publishers for peer-reviewed journals. They provide the guidelines for code of conduct and best practice guidelines, define publication ethics, and they also advise editors on how to handle cases of research and publication misconduct. So I have my references mostly are from ICMR and National Institute of Epidemiology course material that they have undertaking a course for postgraduates, residents, and others who are interested in publishing and writing articles and doing research. And another article by our editor, Dr. Santosh Honavar and Sabyasachi Sangupta, published in EIZOC. So basically, they have divided the ethical issues into 6 categories. There can be many, but broadly, they have categorized into 6 mostly. The first is the ethics review and breach of confidentiality. The second is fabrication and falsification. The third is authorship issues. Fourth is plagiarism. And fifth is ethics related to submission. And sixth is on conflict of interest. So let us discuss one by one. The ethics review committee is very important, as any human or animal studies needs ethics committee approval as per the national guideline. And also declaration of Helsinki also wants that to be followed. So this is very important. We need to have undertaking any studies, ethics committee approval for that, and also informed consent or assent from the participants. This is very important also, and we have too many journals, they ask for the consent forms to be submitted or any proof for that. So trials also, any drug trials needs registration with clinical trial registry. And what is very important is the data confidentiality. So we have to take permission of the institution if we want to share the data with someone else working in a different organization or institutions. So what is very important nowadays is the confidentiality of the participants, and the data is to be properly maintained. Second is fabrication and falsification. So fabrication mainly is because if the research results are not generated from this study. So we have done a study in one aspect and tried to find out something which is not actually coming out of the study. And second is the falsification. If the research results generated by manipulating data, mostly done by, suppose you have 30 participants and then you can multiply it to any number to get your result, then that amounts to falsification. So these are extremely serious forms of research misconduct. So if editors or reviewers are suspicious and at any point of time, they can ask you for the data sets to confirm or alleviate the suspicion. So editors may ask for the data set even after a few years of publication if certain doubts are raised. So all data from clinical studies should be preserved for future use. And another, authorship issues are there because authorship confers credit, no doubt, but also it implies responsibility and accountability of the work. So all the authors has to take the responsibility and accountability of what is published in any journal. Each author should be clear about their responsibility. It is mandatory to declare the contribution of each author and also decide the authorship while writing the protocol. It is to be decided a priori what should be the sequence of authorship. And the International Committee of Medical Journal Editors recommends that authorship be based on 4 criteria. Those are substantial contribution to the conception or design of the work, or acquisition, analysis, and interpretation of data particular. The second is your contribution in drafting the work or revising it critically for important intellectual content. The third is final approval of the version to be published and agreement to be accountable for all aspects. So the order of authorship is decided by extent of involvement. So what are the authorship misconducts? Mostly ghost authorship. Ghost authors are those who contribute substantially in the development of the paper, but are not given authorship or acknowledgement in the paper. These are usually paid authors. Gifted authorship typically provided to heads of institutions or department heads, even without significant contribution to the particular study. The third is the guest authors, usually provided to individuals whose presence as a co-author significantly increases the chance of acceptance of the manuscript. So these are to be avoided. Ethics related to submission. Simultaneous submission of a paper to different journals, it amounts to misconduct and breach of ethics. Duplicate publication. Submitting a new manuscript with same hypothesis, same method data, and same discussion and conclusion in a different name is also a breach of ethics. Self-citation, citing own publication also out of context. Then predatory journals, as has already been described by Dr. Sankos, that we have to be very careful in selecting our journals and not to publish in predatory journals. Then plagiarism is a most serious publication misconduct. So what is plagiarism? Use of previously published manuscript by someone for his or her manuscript or on reference the use of others published and unpublished ideas without consent, credit, or acknowledgement. So it is the appropriation of another person's idea, process, results, or words without giving appropriate credit and putting in the manuscript. So the most common form of plagiarism is copy paste, word to word. So types of plagiarism, mostly there are direct plagiarism, complete or partial copying without acknowledging the original author, self-plagiarism, duplicates of previous works or sentences. What you have written in one of your paper, if you put it same verbatim in your another paper, that also amounts to self-plagiarism. Redundant publication or salami publication, publishing similar manuscript or reports based on same experiments. So inappropriate division of study outcome into more than one article leads to redundant publication. So direct plagiarism are mainly 2 types: clear plagiarism, unattributed use of large portion of text or data presented as if they were by the plagiarist, and minor plagiarism, copying of short phrases only, or phrases in discussion of research paper without any misattribution of data. Now, duplicate publication. co-classifies duplicate publications into major and minor offense. Major offense is based on the same data set with identical finding or evidence that authors have sought to hide redundancy by changing title or author order and not referring to previous papers if we publish, that amounts to major offense. And redundant publication or salami slicing is considered as a minor offense. So how to avoid plagiarism? Avoid copy paste. Don't try to copy paste what is written in one journal or one article and put it in your own article. So write the concept in your own words. Spend more times to do this. Acknowledge original sources. Cite references accurately. Avoid writing several articles at the same time. So there is chances of writing the same sentences in different articles. And anti-plagiarism softwares also are there to check for plagiarism. If you suspect you have detected plagiarism by others also, you must report it. Then paraphrasing also can be done. Paraphrasing is restating others' ideas by changing their words but not copying them word for word. It is often done when citing a reference.
Savitaji, you are not audible.
Lost the connection.
Probably we lost his.
I think we lost connection. Just come. You are muted.
Unmute.
Not able to hear you, sir. Unmute.
You're not audible.
Sir, maybe go to the mute button on the left side. There's a small arrow there and change the speaker. Whatever speaker is there, just change it. I don't know if you can hear us also.
Yeah, that's correct.
Can be called in mobile.
Yes, I'll put a word to you. There's a lot of interruption, I think, there. Yes, can you hear us? We can't hear you. You're inaudible. You're again muted. Yeah, sure.
He's unmuted, but the voice is not coming. He's unmuted.
Yeah.
Hello, am I audible now?
Yes.
Okay. So after plagiarism, the last one is the conflict of interest. Any financial, personal, or social other interest that directly or indirectly influence the conduct of the author with respect to the manuscript amounts to conflict of interest. So having conflict of interest is not considered unethical, but failure to disclose it jeopardize the outcome of the paper. So by disclosing, it depends upon the readers to determine the influence of such conflict of interest on conclusion of the paper. So there are certain direct conflict of interest and indirect conflict of interest. Direct when the author derives employment, owns stocks or patent of the product. Indirect conflict mostly arises when the author receives honoraria and research grants to do the study, paid lectures to popularize the product. So consequences of all ethical breach in ethics and misconduct is Pope recommends. It depends on the type of misconduct, major or minor. Author can get blacklisted by member journals. Institute can take action. So this is the publication ethics checklist that has been published by Sengupta and Honavar in EIZOC. So one has to follow this checklist to avoid any ethical issues that constitutes approval and consent related issues, data accuracy, falsification and fabrication issues, plagiarism and self-plagiarism issues, submission issues, and ethics of authorship and conflict of interest. So once somebody follows this checklist, there is less chance that there is possibility of any ethical breach. So research and publication malpractice is a major problem in the world. So there are technical solutions by use of softwares, but there has to be educational solutions also. It is directed at all levels, from the personal to the international level, to follow these ethical principles. So avoidance of research and publication fraud is everyone's responsibility without any excuses. Thank you all. Thank you very much.
Thank you, sir, for that hard-hitting and presentation. It encompasses all the things about ethics and plagiarism. I think the discussion is open to the floor. I think anybody wants to have any opinion regarding today's presentations, and I think it was a wonderful presentation covering a lot of things, and it is a very eye-opener for a lot of postgraduates who have never written or who have been never exposed to the literature, and from the stalwart and from the start. Yeah, yes, sir.
There are certain questions in the chat box. You can go.
In the chat box, there are certain questions are there.
Yes.
So one of the questions Dr. Natasha Das is asking: do author metrics such as H index, etc., really matter in academia?
Yeah, it matters a lot because that is how you can measure yourself against your peer publishers. There are many other indices, but H index is something that has been standardized and considered one of the indices. It simply means that if you have 10 articles that have been each cited at least 10 times, then your H index is 10. So basically it has to be cited 50 times for you to get into the H index, at least some of the articles. It's a very nice way of calculating, and that's available on Google Scholar. So I would encourage every author to have a profile on Google Scholar, and that automatically tracks all your publications and gives out the H index and G index.
Another question is, does case reports have any author metrics?
Case report author metrics are the same. Case reports are, as long as they're indexed, they can be cited. In fact, one case report, in fact, it was a letter to the editor on use of propranolol for capillary hemangioma of infancy. In a child with cardiomyopathy, they gave propranolol and capillary hemangioma also regressed. That possibly has the highest number of citations ever, 1,700 plus. So even very small case reports and letters to the editor can be cited very heavily, and that get into author matrices.
I think there are a couple of other metrics, right, sir? The impact of your research in the last 1 year, rather than looking at the whole thing that you've published, because as you start publishing and improving in your particular field, the impact of your papers keep increasing. So rather than looking at an overall impact like the H index, you also have an annual impact or a personal impact factor, which pulls out the number of articles you've published and the number of citations you've had. I think that's also an interesting metrics. I think these are things which play a large role when you're applying for grants, and you're, these two play a lot of importance.
Thank you.
There is a question for Praveen. Can you please share the details of mobile phone attachment to take good clinical photos?
Yes, sir. I'll share it personally, sir. It will be not good if I put it in the public forum. I'll be sharing it personally.
The question is from Dipali Singh.
Yeah.
Then another question from Dr. Chaitra. What would you say about the citation probabilities of case reports, and as case reports are not cited very often, does it in any way affect the author metrics?
Well, I think
that has been addressed, sir. That has been addressed.
We also limit in author numbers in different kinds of publications. Original research versus reviews versus case reports.
What is the? It's not very clear what you said.
Limit in author numbers in different kinds of publications.
Oh, that depends on the journal. Some journals restrict to 6. Some journals allow innumerable number of authors as long as each one has contributed to the manuscript significantly. So it all is journal dependent. There is no restriction from anybody else.
I think it's also article dependent. Some of them allow more authors for probably review, and for case reports, they have fewer number of authors. So again, a very journal dependent thing, and even the type of article. So I had a quick question. What about the case reports IGO once it gets indexed? Because the citability may not be very high, so the impact factor is always going to be on the lower side, is it?
Impact factor will improve over a period of time, but yes, of course, all journals which have case reports will have a lower impact factor. That is for sure, because you will have a large number of publications and many of them may not be cited too high. And that is the reason why most of the case report journals are not doing so well. In terms
no,
of
but this is an exclusive case report journal. Even then, I don't think we can expect it to do. I mean, it obviously used to bring down the impact factor of the parent journal quite a lot. But since now we have moved off and there's a new journal, even that's not going to have a very, very high impact factor, I think.
Case report journals typically don't have high impact factor. In fact, American Journal of Ophthalmology case reports has an impact factor of less than 1.
It all depends on what case reports you are having. And most of the cases are general cases they report rather than specific ones. No, you have a unique case which will be cited very often. Then the impact factor can go up, but that do not happen with all the case reports. That is the problem.
So what are your thoughts on these journals which have subscriptions or for, you know, we've taken one. I don't know. I mean, at the end of the year, I'm going to do the math, actually, whether it was useful to us, you know, having taken the subscription, or whether if we had published individually also, we would have come to the same. Because that enthusiasm when you're taking the subscription doesn't really stay sustained. It starts coming down, and then at the end of the 2 months left the deadline, everybody's now trying to submit. So I don't know whether it really matters.
No, it matters in the sense that, you know, your postgraduate students and fellows will get a window of opportunity to publish in a journal which is peer reviewed, which is indexed. And of course, the fee is being paid by the institute because it's an annual subscription. So you don't have too much of restriction on the number of articles that you want to submit. So number of publications from the institutes will rise, and you have given opportunity for youngsters without them having to pay to publish in a case reports journal. So for beginners, I think it matters. You're giving opportunity to them. For people like you, I don't think it matters.
So one more point that I wanted to add to what Dr. Patnaik presented. He talked about conflict of interest. Recently, the ICMJ last year, I think they updated and said we don't discuss conflict of interest anymore. It is disclosure of interest. So it is up to the author to disclose everything, whether he thinks it is a conflict or it is not a conflict. And then the publisher, I mean the editor and the readers will decide whether it's a conflict or not.
Absolutely. Terms have changed.
Yeah.
So I think it is time to stop here. Am I right?
Yes.
So, I would like to give you some few comments. It's a really wonderful discussion, starting from the case reports to the writing a paper, original article, and also the review articles. And I think it's a wonderful learning from our postgraduate students. And I hope at the end of this session, some of the postgraduates are motivated enough to start the writing today only. As Dr. JB said, that enthusiasm, persistence, commitment, and passion is highly required for the writing a paper. So I think some of the teachers are also here with us. If they can motivate their students, they can come out with good articles. So these two words, definitely, I really appreciate all the speakers giving due importance to each topic. Before Dr. Santosh Mahapatra, our co-coordinator, offers the vote of thanks, I request today's host, the entire pharmaceuticals, to play a small video. So it's over to Anmol. Thank you, Dr. Santosh Mahapatra. Please offer the vote of thanks to all our guests.
Before that, I think last comments from Dr. Santosh, editor EIZOC.
Thank you, sir. It was really wonderful to have this kind of discussion with people like Dr. Jyotirma Biswas, Dr. Santosh Sonar, and many of my known faces like Aniruddha, Chaitra, and our own Dr. Sabyasachi Patnaik. Apart from them, other speakers like Dr. Jain Kumar Das, Dr. Manvi, and Dr. Resmi, they wonderfully presented, and we have almost covered everything regarding publication. So I'd like to thank all the speakers for their wonderful contribution, and EIZOC and EIZOC, which have been presented by Dr. Sabyasachi Patnaik, Dr. R.C. Meher, Dr. Swaraj Bhattacharya, and Dr. Santosh Sonar. As always, Dr. B.N.R. Subudhi, everything starts with him. He's the chief coordinator for the program, and our advisor his advisor to us throughout the year and throughout the sessions, Dr. Ajit Babu Maji. And wonderful work done by Dr. Soham and Dr. Praveen, who acted as co-moderators. Last but not the least, the Inter Pharma, which provided us a platform to do this wonderful program. With this, I would like to conclude the session. Thank you all.
Thank you.
Good night.
Thank you, Dr. Santosh Sonar, because we have discussed in the AIS conference. Now it has become, reality today. So thank you. Be with us in our future programs too. It's not the beginning of ORPI 1 only. So we'll be having a series of presentations in the future. Please guide us.
Thank you so much.
Thank you. Thank you. Good night, everybody. Bye.
Good night.
Good night. Good night.
So much on behalf of the